webinar series. My name is Bastian Kwas of the ITU, and it's my pleasure to facilitate today's seminar. And for the opening remarks today, we have Dr. Bilal Jamoussi, the Chief of the Study Groups Department at ITU. Dr. Jamoussi, please, over to you.
Thank you very much, Bastian, distinguished delegates, panelists, and participants. It is my pleasure to address you all today for episode number 17, Emergency Responses in Smart Cities, Driving Resilience in the Post-Pandemic Era. This webinar forms an integral part of the Digital Transformation for Cities and Communities webinar series. In the past decades, while efforts have been dedicated to accelerating progress towards the strengthening of emergency responses for public health crises, digital health technologies remain largely untapped as a means of managing of such health crises. The COVID-19 pandemic has highlighted the importance of digital health technologies and their role in building awareness, enabling effective contact tracing, and boosting vaccination drives. COVID-19 has accelerated the use of digital health technologies in the evolution of healthcare services, not only for the innovation of equipment, but also in support of delivery of care. Telehealth continues to be a savior in regions where there is an imbalance in the doctor-patient ratio. With the help of telemedicine facilities, it is possible to provide emergency medical services in diverse environments, remote locations, under urgent care circumstances. However, international dialogue is still needed to lay out the framework for the deployment of these technologies, given the concerns revolving around personal data protection within the smart city ecosystem. The United for Smart Sustainable Cities, U4SSC initiative, which is supported by 18 United Nations agencies and programs, has developed the report on smart public health emergency management and ICT implementations. The report further elaborates on how technologies such as artificial intelligence and the Internet of Things can be used to generate prompt responses to epidemics and pandemics, while simultaneously adopting generic public health operational processes derived from the methodology that adopted for past crises. This report explores the importance of surveillance mechanisms supported by emerging technologies in the urban ecosystem to manage public health disasters. Professor Leonidas Antopoulos will elaborate more on this landmark report during this webinar. Additionally, ITU, in its role as an international standards development organization, is also working on digital health through its ITUT Study Group 20 on the Internet of Things and Smart Cities and Communities, and ITUT Study Group 16 on multimedia and digital technologies. The Continua Design Guidelines have been approved as ITUT Recommendation H.810 series on personal health systems. These guidelines define a framework of underlying standards and criteria that are required to ensure the interoperability of components used for applications monitoring personal health and wellness. ITU also enjoys a long-standing partnership with the WHO, the World Health Organization. This collaboration gave birth to the ITU WHO Focus Group on AI for Health, which is setting the basis for using AI to improve the provision of healthcare facilities on a global scale. Through this focus group, both organizations are working on the standardization of a framework to benchmark solutions linked to the application of AI within the sphere of health that will help support wide-scale adoption of AI for medical care. As ITU focus groups are open to all, your participation is most welcome. I thank you all for your kind attention, and here's wishing you an engaging webinar ahead. Thank you very much.
Thank you, Dr. Jamousi. With setting the stage for that, I think we can dive right into our discussion. Let me just give a few house rules first. So the webinar is being recorded, and we would encourage you to participate in the discussion. For that, you may use the Q&A functionality that you see at the bottom of your screen. Those questions can be asked by the facilitator, which is me today, to the participants, to the panelists. And then additionally, there is the chat functionality, which you can use to communicate with the other participants. You can see also the rules now on your screen. And with that, I'd like to invite our first speaker, who was already introduced by Dr. Jamousi, Leonidas Antopoulos, the Working Group 2 leader of the U4SSC thematic group on city platforms. Leonidas, please take it away.
Thank you so much, Bastian, for this introduction. Hello, everybody across the globe. My name is Leonidas Anthopoulos, and I'm going to give a brief presentation about the deliverable entitled Smart Public Health Emergency Management and ICT Implementations, according to this brief description that you heard previously by Bilal. So, next slide, please. The purpose of this deliverable was to investigate two observations that were collected during the COVID-19 pandemic. Actually, we realized that smart city infrastructure was not utilized according to the promises that it had grounded, like raising alerts, early alerts, before their appearance. This was one observation. And actually, even during the several pandemic waves, we did not experience extreme utilization of the smart city infrastructure. We only collected some emerging technologies, some extreme and emerging and efficient new services and new applications around the globe in several cities. The second observation was that we experienced mass surveillance systems that were based on the ICT technologies. And we wanted to be sure about when they start and when they finish this surveillance. After grounding two questions that were based in these two observations, we tried to examine and investigate several things. And this information was collected in this deliverable. According to the structure of this deliverable, as you can see, we performed an analysis of the terms, a gap analysis of existing standards about smart public health, literature analysis to understand how different pandemic management frameworks operate, actually how they operated in the past, how they evolved during time. We also explored several case studies around the globe about how the cities responded to the COVID-19 crisis, and we concluded to a framework for smart public health management with the utilization of smart city. Next slide, please. The first step was to collect and define several terms. Probably you're familiar with them, like resilience, public health, epidemic and pandemic. What is a surveillance system? And we also explored several indicative surveillance systems and compared them in order to realize how they operate, what types of technologies they use, and what is the framework that they follow. Next slide, please. And this analysis showed us that all the public health systems follow a particular, quite similar process. This is quite a generic process, which shows that a public health system consists of 3 dimensions: a control center, which is guided by the headmasters of the public health system, hospitals, and research laboratories. Hospitals collect information from the incidents that appear in them. They analyze data about sicknesses that appear in these sites, while laboratories perform frequent analysis of events, of incidents that they collect, and they try to realize whether this evidence exceeds a particular baseline that plans define, that their literature shows us that they have to follow and observe, whether they document the appearance of a new outbreak. These data coming from hospitals and laboratories are combined, and they are going directly to the control center, which monitors and assesses the evidence to realize whether we have an outbreak or not, and whether we have to take measures and communicate figures and start launching measures like lockdowns, social distancing, and so forth. So we have to keep in mind this process in order to realize how we concluded to the framework that we will show you later. Next slide, please. All this information shows that all public health systems have this quite the same structure. The gear size that does not show something like importance. So a public health system consists of data sources coming from research labs and hospitals, as we showed earlier, a surveillance system which shows how we collect this information, a response plan which is drafted by the leaders of the public health system, and a network of organizations that collaborate, collect information, transact, and handle a crisis. Next slide, please. After realizing how the public health system works, we wanted to know how this system can be integrated within an urban space with other processes that deal with crises, with emergencies. And we explored several emergency management systems in cities, like this one, which is representative, which is a disaster resilience of place model, and consists of, as you can see, two different phases. The first one, which is the preparedness phase, and brings together all the stakeholders that have to collaborate, prepare plans, and realize whether an emergency appears and cope with responses against this disaster. And when the capacity of the community is exceeded after the appearance of an emergency, the community has to adapt to a change, improvise, and come to social learnings. The degree of recovery shows whether the community has to mitigate to an extreme effect or not. Next slide, please. We also collected information from different applications, sophisticated systems that were developed quite a few months after the appearance of COVID-19 pandemic. The Asian cases, and more specifically the Korean cases, responded quicker compared to other areas because of the appearance of pandemics a few years before, like the H1N1 pandemic that we explored during the collection of information that you saw before. All these cases can show how cities emerged and provided with additional toolkits the communities with the use of information technologies. Next slide, please. And helped us realize that smart and sustainable cities can be utilized and integrated with public health. The architecture of the smart sustainable city, like it is introduced by the ITU, and it is presented in this slide, shows us that the IoT sensing can collect information and represent phase one, delivers alerts to the appropriate agencies coming from smart healthcare and smart safety and emergency systems, and collaborate and coordinate the next phases that deal with disasters, like monitoring, simulation, and safety management. Next slide, please. So we concluded to this framework, which, as you can see, consists of the dimensions that we saw before in the public health system. And now you can see that two more dimensions have been incorporated. One is for smart city, and the second one is for local stakeholders. Smart city infrastructure can be used for continuous sensing and data analysis and contribution to alerting the community, while local stakeholders are here because they develop information technology systems like we saw earlier in the examined use cases, and perform also crowd sensing in order to support surveillance and support the sophisticated applications that they deliver. Next slide, please. We also tested the framework with this additional UML data flow diagram, which shows how this smart city infrastructure is integrated with the data sources coming from the public health system. You can see that the dashboard, the web portal, several ICT solutions contributed by the local stakeholders are here and collaborate with the rest. Next slide, please. We also explored the role of an artificial intelligence because we saw that several systems were launched in order to perform analytics and estimations about the sprawl, about the COVID waves, the pandemic waves, and about the demand for beds in hospitals. This was used across the globe in several cases. Next slide, please. All this information shows us that this framework can be integrated with the smart city platforms, which was the primary purpose of the thematic group of United for Smart and Sustainable Cities. And more specifically, the city IoT infrastructure feeds the public health system with information. The city apps collect information from citizens and also disseminate information and alerts. Smart services are used to deliver information to the appropriate groups, and city dashboard and public websites are also utilized in order to inform the community about the progress of the pandemic. And next slide, please. This was my presentation. I hope it was fluent to you to make you realize the role of this deliverable and how we can enhance the role of the smart and sustainable cities for future pandemics. I would like to thank you for your attention. And of course, I'm here for your questions.
Thank you very much, Leonidas. And we will be taking the questions at the end. I already saw a number of questions coming in. But for now, thank you, Leonidas, and we will move on to our next speaker. That is Anna Rivière-Cinnamon of the Pan American Health Organization, which is the regional organization of the World Health Organization, the United Nations Specialized Agency for Health, who is the representative of PAHO in Panama, and also the co-chair of the ad hoc group for digital health technologies for health emergencies of the ITU WHO focus group on AI for health, which Dr. Jamousi mentioned earlier in his opening remarks. And please, Anna, over to you.
Thank you very much, Bastian, for the introduction. Let me just quickly share the presentation. Give me a second. Please let me know if you're seeing the presentation correctly.
Yes, we can see it well. Thank you, Anna. I think
okay, perfect. Thank you very much. Good morning, good afternoon, good evening to everybody. It's a pleasure to be a part of this panel. And my name is Anna. I'm currently the PAHO WHO representative in Panama, but I used to work in the health emergency department for quite a few years, and particularly during COVID, doing data analysis during the COVID epidemic, also doing modeling and projections. And one of the things I will be talking about is some of the work that we did as part of the ad hoc group for digital technology and digital technologies for health emergencies as part of the ITU WHO focus group on AI for health. And a little bit of a reflection on what happened during the emergency and the role of data and technology during that period of time, and how COVID has impacted the way that we tend to work in terms of epidemiological data. So what we used to be before COVID was something like a dinosaur in terms of pre-COVID data collection and the use of technology. Everything used to be very manual and very not automated in terms of public health. I'm talking in terms of the epidemiological data. You know, what we used to do in terms of surveillance is always very structured. You have event-based surveillance and indicator-based surveillance. We have different types of systems. Maybe the more techy one is the event-based surveillance of different types of platforms that we could use, but there's the EIOS, Epidemic Intelligence, from open sources that we tend to use to monitor what's happening in terms of rumors. But then when we talk about traditional data, which is the most epi-oriented data associated to specific diseases, then we see that things used to be very manual in terms of data collection, specifically for rare diseases or diseases that are, of course, not known in that case. The only network that is really more structured is the sentinel surveillance for respiratory diseases. And that's what is called in the region SATINET or GIRIS in the global network, let's say, and it's a system in which all respiratory viruses, influenza and others are monitored on a weekly basis based on sentinel surveillance in specific hospitals or healthcare facilities as part of that network. But what traditional data gives us is it reflects the information that we get, reflects the efficiency. It needs to be efficient, effective, and representative and periodical if we want to have a surveillance system which is of good quality and reflects what really is happening in a country. So what we used to have at the beginning of COVID was kind of driving a car without really seeing the road, because we did not have any specific information on how COVID was evolving, of course, because it was new, but it was difficult to get information quickly on a daily basis, which was what we were monitoring. So one of the things that we did when we were working in the ad hoc group was trying to identify all the applications that were used during that epidemic and try to classify them within the framework of recovery, response, and preparedness and prevention, as you can see in the slide, so that we could identify which were the applications or the digital technologies, AI powered, that could actually help us get information at each of those stages, either early detection or surveillance, or even training, or even supply chain, and also healthcare services. Of course, this has to be performed within a framework where you have enabling factors, such as, of course, network and data sources, etc., but also digital governance. And what we did in that ad hoc group was to try to do data collection or case collection of those specific applications that was done through first expert knowledge as part of that specific ad hoc group. And we did these kind of like specifications that you can see in the slide, where there's a description of each of the technologies that were identified and used in different countries. But we identified from the network 27 cases, but we also did a literature review based on certain criteria, particularly the use of AI technology that was done through an intern that we had at the WHO, who was studying digital technologies and artificial intelligence in Yale. So he managed to find 44 referenced articles which actually described technologies that were used during COVID and that were specifically using AI-enabled processes. And those different technologies were classified, as you can see, within the framework of the PPRR. So prevention, preparedness, response, and recovery. So you can see there were many more in terms of prevention and also on response than on preparedness and recovery. But you can see that you had a lot of, quite a few technologies that were used for COVID screening, contact tracing, and data sourcing or reporting, and also on response in terms of medical imaging and social networks and misinformation. This is actually a very useful literature review because it might help us in the future try to identify how these specific digital technologies can be used or adapted not only for COVID, but maybe for other respiratory diseases, or eventually adapted to respond to other types of diseases depending on the characteristics. So just to finish up, what would be the way forward? It's what I was mentioning in terms of trying to leverage all the information and all the efforts that have been conquered, let's say, through the experience of COVID, and try to make those technologies more available for the near future, so that these technologies are part of the early warning, but also of the response and the recovery within those cycles of epidemics and pandemics. But for that, what we need is to have a technical enabled ambience, let's say. We have to identify minimum sets of requirements for those technologies in terms of network, data sources, and computing capabilities, so that we don't generate more inequities of the use of those technologies. We also have to think thoroughly about digital governance, considering the governance factors on AI and other digital not only COVID. Also, we need to those technologies so that we have measures and indicators to evaluate the outcome and the applicability of these different digital technologies based on AI and the digital interventions. And I think that would be extremely useful for public health in the future, because we tend to be very slow in engaging with new technologies in comparison with other fields, like, for example, finance or marketing, etc. But in public health, we tend to be very reluctant to adopt new technologies or new ways of managing and generating data. And I think one of the lessons learned from COVID to make cities and eventually communities more resilient is to try to embrace those new technologies to obtain different types of data that can allow us to better prepare and be more resilient in terms of what could happen in the eventuality of another epidemic or pandemic. So thank you very much. If you have any questions, please do not hesitate. Thank you.
Great, thank you very much, Anna. And I see that more questions are coming in, so thank you very much. Please keep them coming. I also intend to ask a few questions of my own. And with that, we will go now to the final speaker of the remarks from the final speaker today, which is Maxime Interbrick, the COO of Sparrow. So, Maxime, please.
Yes, hello. Hello, everyone. I hope everyone can see my screen. Yes, okay.
Full screen.
Yes, my name is Maxim Interbrink. I am CEO of Sparrow, and we are Swiss-based startups that initially take a challenge of taking our development of the new approach for urban measurements and urban collection of the data using IoT devices and using them in the way of innovation. We took this challenge into joining ITU and taking this into the next level of the implementation, because at one of the biggest challenges that we're having today is merging between and creating a bridge between administration, municipalities and governments, and actually innovations at one side, and what citizens and what people are living in the city aware and would like to receive from another side. So Sparrow was founded 3 years ago, and the goal of the company was to bring a very informative and important data on the street level 24/7, covering areas such as air pollution, noise, road quality, and many other parameters and hazards that are affecting our lives in the city, because obviously urbanization is here, and living within the cities in COVID times was even more difficult. And obviously the city management, the management of different areas at the street level is extremely important. So we come up, with the very straightforward approach where we combine between the hardware which were developed under academical support in Switzerland for different universities in Europe and in United States as well. And this hardware is pretty unique and pretty simple to use. It's implemented in the public transport. And during the public transport is doing its routine job, we're able to collect information which is extremely essential from air pollution point of view, noise, road quality, and many other things which are relative for different departments of municipalities. So the process is extremely simple. The nodes being installed on top of public transport, and then basically while they're doing their routine job, we're creating some sort of map, that this map corresponds to what we call hotspots, the hotspots of air pollution, noise, or many other things which we see in the city, such as heat islands or different gathering of pollutants. Then we basically take all this information and we blend and we mix with additional data that city already possess, and we get the real map that is allowing city to control the air pollution measurement and create different prediction methodology using a big data approach. So why we decided actually to join ITUT SG20 for the question 7, because we realize that what we have achieved here can be used in a very generic way, and it can be created as a standard, and basically allowing cities to use our approach in a very flexible way, no matter where they are. It can be either in Europe or United States, it can be even in development country, because basically our approach does not require huge investment, neither in infrastructure, because we're using existing infrastructure of public transport, neither in extremely expensive sensors, they all using of the low cost, or basically data gathering collection process can be done in a very standard way. So we decided to join ITUT SG20 Q7 2 years ago, and we are establishing and leading our own standardization process. Thank you very much for the team of ITUT, extremely helpful, and everyone that involved in this part. So in order to make our standard visible and clear for many cities, we decided to implement different use cases. And we have piloted our approach already in Switzerland, in Geneva, also in city of Antwerp, also in cities of London and other cities in the Middle East, where we brought the boxes and we collected this information on the street level. Basically, one of the best approaches and implementation is where city able to use a trusted data and information that come from the IoTs and devices that have been tested and properly certified. By that, we're basically minimizing the risk that the data can be either manipulated or basically presented not in a wrong way. So there is a very important process that companies involved from the private sector needs to pass in order to be able to provide this data for the city from one side, and the cities needs to take this challenge and create an ability at least to accept the data in a form of different analytical solutions in order to address to the problems, and again on the street level. For us, it was an important challenge, and we realized that what we're doing is basically meeting KPIs through the ITU-T standards, and we can cover large amount of the KPIs, which allows to the city to find a proper solution in a very flexible way, in a very generic way. So for us, it was extremely important to bring all those innovations to the municipalities and help them to start using this innovation without too much of risk of spending public money on solutions which are not capable to deliver. And by simple implementation of the proper IoT, we were able to create a bridge between the innovation and the cities in a sense of air pollution measurement, noise measurement, and other parameters which they all can be described as environmental status of the city. So the COVID-19 during the pandemics, we had a lot of opportunities to use cities as a blank page. So it was a huge reduction in traffic. People broke their daily routine. We were able to realize that we can see streets empty, and we can realize how we can manage and deal with different air pollution. After the COVID-19, obviously, everything took over, and we already see a lot of movement in the city. We already see a lot of presence of different pollutions, and we able to identify that this transformation into the place where the digital IoT devices can help to navigate all these parts related to the air pollution can be implemented already now. So we also realize that it's important to engage citizens as well as municipalities and administrations, because basically citizens are become a very important part of the pollution footprint, and it's important to realize that by providing a very accurate, measurable data for the citizens in a sense of the implementation of the data, this can be helpful to allow them to make a very measurable actions and decide about choosing change their life during their activities in the city. So we identify an extremely important part into moving forward and making cities more resilient and more sustainable. We identified the process that we call from measuring to detection, and this a very proactive approach where after the measuring, we need to detect and identify these hotspots and the source of the pollution. And this detection needs to be done in multiple levels in order to understand the source of the pollution. And then after understanding, it is impossible to tackle this pollution in different ways, whether it's related to the municipality or the private businesses. And of course, the IoT role in data collection is extremely important, because IoT devices today, in many cases, requires a lot of attention, and they all needs to be framed and properly used with proper maintenance, proper health check, and constantly monitor it. At the same time, the data that was collected by IoT also needs to be processed and aggregated, because it's simply impossible to use the raw data and just throw on maybe the map or provide it to the citizen in a very direct way. So from our perspective, the city should provide the citizens with environmental city status, and this approach will allow citizens to understand on the street level the pollution hotspot and density in many, many different ways. And of course, this will affect the everyday life of the citizens in the post COVID-19 age, because basically when people goes outside on the streets, they either doing sport or walking the streets with the family. They constantly exposing to the very transparent enemy, which we don't see. It's pollution, and it's important to use IoT in the real time, of course, with historical approach as well, in order to allow people to make the proper choice of the proper direction within the city. I would like quickly to show you some sort of examples that we did with the street view vehicles, and basically we were able to identify different streets, and the Google Street View we provide with the real data coming from the IoT device, and we use a colorful grade in order to provide an accurate information on the street level about air pollution in that case. So basically the drivers or the citizens will be able, by using those maps, to make a choice in real time, whether going into direction of high density pollution or choosing an alternative route and avoiding that. Thank you very much. This is what we do until today, and I'm happy to participate. And if you have any questions afterwards, please do not hesitate. Thank you.
Thank you, Maxime. And maybe I can ask, well, actually, maybe I can ask you to stay on the line, so to speak, and also to join us, please, Leonidas and Anna. And actually, I do have a first question. So was that Zurich, or which city were we looking at there in your demonstration, Maxime?
That was Antwerp.
Antwerp, okay.
Yes, that's right.
Okay. Perhaps while Leonidas and Anna join us, I could already start with a question for you. So how can IoT help change the lifestyle and the habits of citizens to make their lives healthier? That one is for you, Maxime. Is that okay?
Just 1 second. Can you please repeat that question?
Yeah, definitely. Okay, so how can IoT help change the lifestyle and the habits of citizens to make their lives healthier?
Yes, absolutely. So in our case, in the case of the city, while using a proper IoT device, properly installed under all the certification and constantly monitored, like I already mentioned, the data that delivered from this IoT device can be used into readdressing to the citizens, and the citizens can take the decision in the real time. For example, if someone goes out to the to do the sport within the city, because they don't have an option to go outside, or they would like to remain, since the air pollution is extremely dangerous, but at the same time transparent, it's simply impossible to navigate. So we urge big companies such as Apple, Adidas, or anyone else that providing a smartware or smart appliance or IoT devices or IoT where simply alert people when they're moving into the direction of the high density pollution to change and take the alternative route and train in the more healthier area if possible. And this can happen in the real time. And of course, by creating those healthy and safe routes within the city, it's possible to decrease dramatically the exposure for air pollution and obviously make people healthier while living in urban environment.
Thank you. If I may, I'd like to ask a follow-up question to that. So how exactly then do you define the pollution here that we're talking about? What some of the metrics are, particulate matter 2.5, etc. Is that what you have in mind, or do you look more?
Yes, absolutely. We address to the three main parameters today. First is related to the gases, which is CO2, NO2, ozone 3. The second is related to the even more important particle matter, which is today we measure in PM10, 2.5, and 1, this whole range. And the third is related to the what we call climate parameters, such as temperature, humidity, and atmospheric pressure, that they all together support and needed to be taken in consideration while measuring gases and particulate matters. At the same time, we also can identify heat islands within the city streets, because high temperature is contributing for many different infrastructural problems, and and basically what we're going to breathe, what will be extracted from the surfaces of the buildings of roads, while you have almost no shades in many cities due to the lack of the trees, for example.
Okay, maybe one more follow-up question, and then my apologies also to Leonidas and Anna that we'll move on to discussion for you with that. So you mentioned your third approach, which talks about temperature, humidity, etc. Strikes me that those are measures that, for example, in the ITU WHO focus group on A for health that we talked about earlier, there is a topic group which looks at the spread of dengue using environmental factors exactly like that. So humidity, rainfall, where you might have still pools of water, puddles, etc. Is that something that you're considering? So beyond the chemical health hazards that these climate.
Yes, absolutely. I have to tell you that the participation in ITU teach us and gave us an amazing opportunity to think in a very generic and structured way, where we can implement all possible parameters from satellite data up to the underground pipelines, and of course and what we learn, and this is why we're actually leading the standard, is because no single or even multiply measurement is enough. You have to take in consideration as many parameters as possible, and more it's better, in the form of the big data, in order to provide and create proper AI and machine learning opportunities. Because at the same, we can continue discussion and continue making digital twins and try to simulate, but we have a real life as well, and we have a life on the streets of the city which needs to take the action quite urgently. And if you need to build infrastructure, if you need to reinvest in all that, this will take ages, while people need to have solutions already today. So obviously we always looking into the cities in the very individual way, because every city, like what we call, they have their own DNA. And this DNA is extremely important to realize. And if additional parameters can be added, we absolutely welcome, and we will be happy to collaborate on that side.
Okay, thank you very much for taking the time to discuss that. So then let's move to Leonidas, if possible. Given the growing proliferation of devices, digital innovation is a key part of health and emergency management. Can you provide case example or examples of a city that implemented health and emergency initiatives?
Good question, Bastian. Thank you for asking it. Actually, it comes close to a question coming from the audience about the types of healthcare services, smart healthcare services that are being delivered. Well, most of the undertaking initiatives that can be documented around the globe mainly concern healthcare initiatives, and more specifically, remote support mainly of elderly people, as well as people with chronic diseases. In my understanding, the reason was that cities have limited authority in delivering health services, direct health services. Mainly, they are supported by the corresponding ministry. In this respect, several innovative efforts for remote healthcare service delivered can be found around the world. I am familiar with several cases in Greece, coming from Thessaloniki, Trikala, the city that I represent, Larissa, where corresponding municipal agencies served particular focus groups in their communities. In terms of emergency, some cities that I know, for instance, Trikala, have embedded technology in registering and monitoring their resources under extreme conditions, like fleet management, and in collecting data, sensing environmental changes, like river level monitoring. Thank you, Bastian.
Okay, great, and very good that you noticed. Indeed, my question was similar to somebody from the audience, Leron Brathwaite. That was so. Thank you also, Leron, for that question. Maybe one more question while we're talking, Leonidas. In your opinion, what would be the best approach to plan for public health within cities in the digital age?
Another good question, Bastian. Thank you for asking it. The transition to the digital innovation age has transformed several industries, as we have heard, at least today, but it has brought in its wake a digital divide, giving the comparatively lower levels of digital literacy and accessibility to technologies among several types of populations, like aging, like people that do not have access to funding to have access to technology. With the appearance of COVID-19, accompanied by the pandemic, we have witnessed intergenerational digital divide by isolating city populations and negatively impacting communities' physical as well as mental health. However, in my understanding, it is possible to turn this adversity into an opportunity. In other words, instead of digital technologies being the enabler of the digital divide, they can be leveraged to alter the lifestyle, as Maxim presented, of the local community during the time of crisis. Thus, the apt approach to enhance the quality of life in the local population can be the use of digital technologies to prepare and respond against public health crises with early estimates and alerts, speedy medical attention, and adequate mitigation. During the pandemic, we must admit that, as we presented earlier, such alerts were not generated, while only in some cases digital technologies emerged quickly to support public health response and community mitigation, like IoT, cognitive behavior analysis, social media platforms. Technologies like this helped mitigate loneliness caused by the lack of social engagement. I had the pleasure to lead the working group number 2 for United for Smart and Sustainable City. I presented the report earlier about smart public health emergency management, which has also stressed on the importance of smart services based on emerging technologies like AI and IoT in generating alerts when required to emergency services in response to accidents or incidents involving the local community, either in public spaces or within their homes. Thank you. I
Great.
hope I covered it.
Yes, I think you covered very well, Leonidas. Thank you. Let me take the opportunity to move on to Anna, and let me also note to our participants that Anna apologized that she could not join on video this section of the seminar today, as she had to go to a meeting since she's in Panama. One imagines in the city of Panama. So Anna, if you can hear us, for you this question: what needs to improve to make cities and countries more prepared and more resilient?
Thank you very much for that question. I hope that you're hearing me well. I'm in the car, so probably the connection is not the best. But thank you very much for that question. And I do think it's extremely relevant to think about all those technologies that have helped, as the previous lecturer has mentioned, the use of those technologies in cities after COVID has helped quite a lot in terms of improving access to healthcare services, and not only the ones that we think more precisely about COVID and diagnostics, but also about what was mentioned before about all these consultations that have been closer to the population and facilitating access to healthcare services, and especially in that case in the post-pandemic area, about mental health. As the previous speaker mentioned, this has been one of the key elements to maintain societies during the closures and the public health and social measures that were implemented in many cities, but particularly in the area of improving access to healthcare services. So I think these are technologies that need to continue to be used and eventually implemented as part of the digital transformation of healthcare services and primary healthcare to improve access, not only for mental health, but for other services that need to be continued in the post-pandemic area, and particularly to follow up on non-communicable diseases that have been not taken care of during these pandemic and post-pandemic period. Thank you very much.
Thank you, Anna. And then while we have you on the line, and maybe you can also let me know if I was right to think that your meeting is in Panama City. While we have you on the line, let me take the opportunity to ask a second question. Is public health rather a field? So maybe taking a small step back, health and public health are fields that have a long and rich history. And as we know, the decisions that are made in the fields of health by the health professionals and others carry enormous weight to the patients. And so for good reason, medical field makes changes to its procedures only when there's strong evidence to encourage this, and there's strong indication that there are no adverse effects. But then with that, the question we do have, is public health a field where digital technologies have not been embraced at the same level as in other sectors? So maybe we can take education as an example that we could compare it to. Does that make sense to you as a question, Anna? And then maybe could you comment on it?
Yes, definitely. As I mentioned during the presentation, I think there's public health has been one of the fields where technology and eventually new devices are taking quite a long time to be implemented for all the reasons that you mentioned. But I think that's one of the let's say positive consequences of COVID. I think there's a lot that we can learn about technology and about the data that can be collected through these new devices in order to obtain better information, which is not always the typical one in terms of disease data or epidata, but there's a bunch of information that can be used for public health awareness and for public health prevention that can be collected through social media and other platforms that can be extremely relevant for disease prevention, and especially understanding human behavior in relation to certain diseases, or the pattern that we that humans tend to have in relation to the response to diseases, which is actually what leads the spread of disease. So there's a huge field in which public health can improve, and technology needs to be embraced by that specific sector. And of course, as mentioned, it needs to be guided by rules and equity indicators and certain, of course, governance pillars. So definitely, yes, in comparison to other fields, as I was mentioned, finance or marketing, there are technologies that have not been embraced yet by public health, and that would be a good way forward. Over.
Thank you. Maybe I'll make a small comment, and bearing in mind that we have a community here of smart city experts, that when we talk about epi, we mean epidemiology. So of course, very relevant to cities as well, but maybe not a term that, or an abbreviation that's always used. So just to clarify, I was wondering, just with regard to what you were saying at the end, about that these technologies provide a good way forward. Would you have an example or two of technologies in particular that you have in mind that think might A, have a large impact, and B, also are positioned or situated in such a way that it might be relatively straightforward to adopt them? I realize that's probably a lot to ask, but maybe you have an idea here. Anna, you're speaking, I think, but yeah, okay.
Yeah, do you hear me? It's not the best connection, but yes, there are technologies that have been used and could be further promoted, like the EIOS, epidemic intelligence from open sources, but there are also other types of technologies that have been used in terms of epi data collection, like automation processes, simple ones, of course, that have helped quite a lot the collection of information. But there's also technologies like contact tracing that has, there are different types of technologies using AI or machine learning that have been implemented in order to favor or maintain contact tracing. And these are things that have been rather successful.
Okay, I believe that we may have lost Anna, but I think, okay, I see Anna is joining again. So Anna,
Yeah,
if you
sorry.
can hear, yeah, we lost you for just maybe 10 seconds now. So
Okay.
if you continue.
Yeah, just to mention that there's also the contact tracing apps that have been used during COVID that can help not only for COVID, but could be useful for other diseases, and there are plenty of other applications that could be used. It's just a question of trying to identify what the extra value, the plus value of those applications are for specific diseases, and the information that can be gathered. But also, of course, not only for data collection, but also for data analysis, modeling approaches, etc. These technologies could really help in order to further the awareness and also the response in other types of epidemics or pandemics. Over, and I do apologize for that connection.
Not at all. Thank you. So just a second ago, I mentioned that we have a community of smart city experts here in the seminar, and actually we have a very large number of participants, which is great. I think health is a topic that also speaks to us all, but beyond that, also something that is a close cousin, if you will, maybe for smart cities as a tool, and then a very logical application. And I just wanted to ask all the participants that are here, maybe we can get an idea of where around the world everybody is joining from. And if you drop us a message in the chat, and I'll just leave my own message now that I'm joining from Geneva, Switzerland. So send us a message where you're joining from. And then let me, in the meantime, good, so we have Nairobi already, excellent. And let me just move on to the questions here that we received. So right at the beginning of the webinar, we received a message from Dominic Baal from the Ministry of Information and Communication Technologies of Sierra Leone. And the question here is, and Leonidas, this will be for you, since it was at the beginning of our seminar. How is ITU responding to less privileged communities in terms of providing real-time data for open use? And over to you, Leonidas, and the other speakers, Maxime and Anna, if you want to also, after Leonidas, feel free to add anything. Leonidas, please.
Well, IoT is really helpful even in cases when where internet coverage is not fluent, because this is another also question, because we can use, let's say, the high band IoT coming from the GSM networks, so we can collect information. Collecting information and perform continuous sensing in terms of public health. This information can be combined with the collection of information that is typically performed in laboratories and hospitals. So this combination of information can become really useful in order to generate early alerts, to perform estimations with machine learning, even in real time. Of course, technology is a prerequisite. You have to have dashboards, you have to have engines, you have to have the ownership of channels to deliver these messages. But in my understanding, this is the particular role that IoT can play in terms of public health, at least. The example coming from Maxime was really useful to show how this collection of information and the transaction with the community can change behavior, can change the lifestyle in real time, actually, and this can be helpful. And in cases during the pandemic, this was really helpful in demonstrating areas that were crowded and send information to the communities in order to avoid passing from these areas or to these areas, especially for people with several health problems that they have to protect themselves. Thank you, Bastian.
Thank you. And I see that Maxime is unmuted, so I think you probably have something to add. Please go for it.
Yes, thank you very much. I see a lot of representations going through the chat right now from the locations which we also aiming to reach out, because at the end of the day, the parameters and the measurements, they need to reach everyone in every areas. So for that requires an industrial effort from the companies that producing sensors or producing those technologies to create a certain localization of what they're doing. We currently trying to see how we can localize our approach in India and in surrounding in areas in order to see an equal approach from what is happening in Europe and in India as well. Because at the end of the day, today we can even work with a very limited access to the internet. We can use LoRaWAN, we can use many different other technologies, and all these are just evolving. So like I said, it can be done only with engagement and participation of the citizens in the cities, if we're talking about the urban environment, obviously. But if those citizens are not provided with the accurate data on the street level, it's very impossible, almost impossible to engage and demand certain change in their behavior. So this is where we need to take step-by-step implementation and include everyone in that process. Thank you very much.
Thank you. Great. So let me take a second here now just to see, we have a large number of people that wrote in the chat. So I start with myself from Geneva, Switzerland. And we have Nairobi, Kenya, Dar es Salaam, Tanzania, Nairobi again, Amsterdam, the Netherlands, Tanzania again, Ghana, Larissa, Greece, Tanzania, Gabon, Rio de Janeiro, Brazil, Ecuador, Liberia, Bangladesh, Kenya, excellent, Tunisia, Indonesia, Sierra Leone, Sudan. Well, great, thank you very much. Please do let us know also which city you're joining in. We are talking about smart cities and communities after all. Let me with that move on to the next question. So this is probably, I think this is for Anna. What are some of the initiatives that cities use to manage their vaccination drive, and how did those cities manage the contact tracing to monitor visitors/passengers coming into those cities? Let me just see if we did not, it might be that we don't have Anna on the line anymore. So I will then ask maybe Leonidas and Maxime, if you have something that you can say to this point, that would be very welcome. Leonidas, you're unmuted, so yes, please.
Yes. Thank you, Bastian. During my presentation, I presented several applications that were used for social distancing, at least around the globe, like the flattening the curve, Trace Together, COVID Watch, How Magen, Corona Date and Spend, and so forth. In terms of vaccination, there are different examples that can be documented around the globe. Typical paper-based that were followed in Germany, to quite, let's say, sophisticated in Europe, where we adopted the green digital certificate that enabled trips between the European countries, while I also experienced some advanced cases in Asia. I don't have them, unfortunately, together with me to provide with more information, but of course, we can transact via email in order to respond more fluently. I hope it helps, Sebastian.
Yes, thank you, Leonidas. And maybe, I don't know if you did already, but maybe that question was from Liron, who also asked the question before. So maybe to get in touch, you can leave your email in the chat and Laurent can reach out to you, or vice versa, Laurent, you can leave your email in the chat and we can all make sure to follow up. I had a few more people that wrote. So we had Nigeria, Takoradi, Ghana. I didn't know the city. That's great. I'm going to look that up. The Philippines and Port of Spain from Trinidad and Tobago. I saw a documentary yesterday that featured Port of Spain. Okay. Here's a question that just came in. I cannot see for who this would be. So please, Leonidas or Maxime, take the floor when you have something on this. How was sensor data effectively shared with the citizens of the city? This is from Kiran Philip Khan. Leonidas.
Again, I have to mention the cases that we collected from the cities around the globe, like flattening the curve, which was an application, a mobile application, which demonstrated the progress of corona sprawl in South Korea. Again, the COVID Watch from Stanford, which tried to disseminate information coming from crowd sensing, while in cases of sensor data, there are several, in my understanding, different types of sensors can be discussed here, like environmental sensors, traffic sensors, safety sensors, and so forth. Let's say all the smart cities have at least some kind of city level dashboard. They collect this information in the dashboard and they can select which data feeds can be open to the communities. And they use either their open data platforms to deliver this information, or some of these services are offered real time, like figures, like combined with social media and generating alerts. I hope it helps.
Yeah, that's very interesting. So, do you think, let's say, when we think about providing this data in a way that can be used as much as possible, the APIs come to mind, application programming interfaces. Is that something that it's used already extensively? I know even 15 years ago in the Netherlands, I could get from a traffic app what time the bus would be coming if it was late, etc. So things are moving there. Is there still headway to be made? And maybe for both of you, what are the obstacles that we currently see in a greater rollout of such APIs? Is it a technical or rather a more governance issue or communication, education? Please, I don't know if you can say anything.
Yes, maybe. Yes, maybe I can react on that, because we literally in the middle of all this happening right now. I can tell you that indeed those technologies exist for some time, but the implementation, we need to make a definition here. From one side, there are helpful technologies, that can help you to learn about the delay of your bus, and there are some alerting technologies, alerting parts which related to some dangerous parts which relate to the hazards, such as to water flooding or forest fires. And it's important to choose what the reason to use and what is the target group, the audience, because you can implement any different sensors, any different infrastructure, but if there is no use and no demand for such service, then it will be just a waste of money. So in the sense of the smart city, I completely agree with Leonidas. We need to start with something very straightforward and something that already work in a very limited environment and can work really, really straightforward with a proper maintenance program and proper IoT devices that can be implemented within the range and speciality of the place. At the same time, many things can be built on top. So, for example, if you have if you don't have a waste management program, the water flooding program can be used as a basics for the waste management as well, because they are very similar in the case of the sensors it's using to identify, for example, placing in the garbage bins for the how they needs to be refilled and checked again. So basically, what I'm trying to say that it's important to identify the goal, identify the proper suppliers, and they make a piloting and acceptance with the local citizens, and then see how it works and implement this across the entire layers of the smart and city to make it more resilient.
Excellent. Thank you, Maxime. Yes, Leonidas, you have.
Yes, and if I may, just to provide with some ideas, we are actually, let's say, expressed by the innovation of different data products that can be built on these types of data. For instance, we can have dynamic documents across the organizations that participate in delivering services. We don't have only to think of the community's people, but even in terms of their representatives, stakeholders that can collaborate in order to deal with a particular issue, like the reduction of traffic, like the obliging of social distancing, and so forth.
Great, thank you. And we still have a large number of questions that are excellent. So I'm going to ask one or two more questions, but I also encourage Leonidas and Maxime, if you have a specific question that you think is definitely worth skipping to, then please go for it. And in the meantime, let me pick mine, and I will put it on the screen. So this is from Gabby from the NCA, the National Communication Authority of Ghana, who would be interested to know how IoTs can be used to improve the yields of farms and agriculture in Africa or beyond Africa, I would add to that. I don't know if there are any comments to this. Maxime?
We are city people here, unfortunately. This will not be from my side, definitely. We are very much limited with the urban areas, yet the presence of ammonia coming from the agricultural part, this is the only link at this point for now. So unfortunately, I will pass this to Leonidas. Hopefully he can help.
If I may, just I read a lot in recent years about hydroponics in cities as well, agriculture in cities, fish and plants living in small microsystems. But perhaps it's not your. I think that's not what you're working on. But Leonidas, then over to you.
Okay, thank you, Maxime, for passing by. Although I'm not an expert in smart farming and smart agriculture, I come from an area whose economy is mainly based on farming in central Greece. So we tried to launch small pilots about precise agriculture, precise farming, precise agriculture, which are based on the installation of several types of sensors, measuring ammonia, measuring humidity in land, in order for the farmers to know how to respond against their plants, against several types of sickness that appears in their plants, in their farming. But I have also experienced, let's say, larger scale projects where drones collect information from larger scales, generate alerts to the farmers about improve humidity or collect their plants. So we have focused alerting to customers with the use of the IoT information. And we have also automated systems that respond according to the collecting information. And let's say, let's say provide with more water to the farm according to the demand that special areas have. I hope I described it as effectively as possible.
Yes, definitely. Thank you. And
and again, Bastian, mainly all this technology is based not on usual IoT environments, but on mobile networks. It's the high band IoT actually that I mentioned earlier. Thank you.
Right. Yes, that makes sense. That's the high band IoT. Okay. Let me try to see, we have about 7 minutes left, and we'll have the closing remarks in a minute from my colleague Simão Campos, who is the secretary of the ITU WHO focus group of AI for Health that we already discussed several times, I mentioned before. So let me go to Dominic Bao from the Ministry of Information and Communication Technologies of Sierra Leone. How is ITU responding to less privileged communities in terms of providing real-time data for open use? Okay, Dominic, I do appreciate your question, but this is maybe a question maybe addressed more to the Secretariat of ITU. So let me see, we will answer that in writing. And then I will move on to another question. Oh, okay, also from Dominic Bell. So I hope that this is okay. What value chains are effective for smart urbanization for both of you, Maxime and Leonidas? And I see Maxime already unmuted.
Yes, I think that it's important to identify the geographical presence of the neighborhoods for the smart urbanization, and depend on each neighborhood or geographical area of this particular part of the city itself. I think the choice of the best telecommunication network would be, and I completely agree with Leonidas here, because communication network are existing almost everywhere, and they are important base on which different other chains can be effectively implemented, because at the end of the day, everything requires connectivity this way or another. So I think that it's important to first see that the infrastructure of passing and transferring different data from point A to point B, or if you wish, from different sensors to the stakeholders, will be working properly, or at least the data collection and storing and afterwards deliver it, maybe with certain delay, but still deliver it, will work properly. Then it's possible to create a link between this collected data and the processing, and afterwards the outcomes and the results and the decision making into based what we call data-driven decisions instead of political driven decision in that sense. So, and I think it's goes into the second question from Dominic about the scalability of the smart city technologies. Actually, today, I think there's a great maturity of many different IoT devices that can be scalable and can be expanded in many cities, but you have to take in consideration that they all needs to be constantly checked and constantly maintained, and it's important to involve citizens in that story, because if there is a lot of proactive citizens that wish to help and scale this approach, this can be very extremely helpful for the cities. Thank you.
Thank you, Max. Leonidas, anything to add? Yes.
Just to add something to what Maxime said, because he covered, in my understanding, the question. In my studies, I distinguish the different types of flows that exist in the city. And I would say data, service, people, and material flows. So if you see the flows, then you can imagine the different types of value chains that can work within a city. And we can also combine them in different terms and generate things like Industry 4, Industry 5 with the use of technology. So examples like smart food, examples like smart water, examples coming from urban renovation, like it happens in Barcelona, for instance. All these types of value chains are effective for smart urbanization. Thank you.
Thank you. Great. So let me say a couple of more things. We're really running out of time here, and we do have too many questions, but please also, our panelists, I believe, will leave their contact details. Maxime already did, and Leonidas will leave it as well. And for Anna, you can reach out to the Secretariat email. We can follow up in writing and would be very happy to do so. A question that's already been asked several times, and my colleague Gifty just left it in the chat. All the presentations are available on the event website. You can find the link here on the chat, and that's also where you registered, so you should be able to find that easily. We are going to have the closing remarks from my colleague Simão in a second, and I just wanted to give a final opportunity to Leonidas and Maxime for any last remarks in 20 or so seconds if you have them. And seeing none, I think we did cover a lot of ground, and there is some things still to be followed up in writing in the chat. We still have a dozen or so unanswered questions. So with that, then I will pass it over to my colleague Simão Campos. Over to you, Simão.
Thank you, Bastian. Thank you, Leonidas, Anna, and Maxime for the excellent talks and the thoughts you shared. I think it was a very interesting session on how we can use smart technologies for good public health emergency management, some of the difficulties and challenges, and the inroads that you have been making. It struck for me that Leonidas actually started with a very good question. Why did the smart cities not being used fully to their full potential for the COVID crisis? It was such a big crisis, and what happened there. And so I think we found a few answers to those issues. I think that when Anna described the three particular topics or elements that are important in considering these crisis managements, the emergency managements. One is the technologies that are available to us to be used, how we put them together, how we use them. The other is very important, and I think is part of the answer to Leonidas' original question, which was a digital governance that is needed to be put in place. So it's a non-technology issue. It needs to be informed by technology, but it is basically the public policies and the creation of a mechanism to how to manage and put this, the use of technology for the public. And then, in particular, when health is attached to it's a theme related to health, and because we have in health a very important tenet, which is do no harm, in terms of how effective certain approach is. I mean, what are the effective results? The outcome evaluation that Anna mentioned in her presentation. So I think these pillars, they help understand the difficulties in putting together solutions that would be effective and help us moving forward. So the technologies, the digital governance, and the outcome evaluation. So if you just mention a few examples using the COVID case, in terms of, for example, detection of COVID DNA in RNA in sewage, and then making a public health decision, apart from this level, should I increase the vaccination? Should we increase the number of beds in hospitals? And if we do, what is the effect on that, the outcome in helping save lives in the end? How effective those measures coming from that detection. So the technology used to measure, the governance in place, allowing us to measure, and the saying who to communicate to and how, and then the decisions made in terms of how to apply a policy and management decisions within the scope of hospitals or communities, how effective they were. Other examples are contact tracing. We had a perfect technology to allow this, but then we came into governance issues, privacy concerns, and we got stalled there. I mean, the real promise of contact tracing was not really realized, in my opinion, because we didn't know exactly. We underestimated difficulties in terms of the governance involved with that, to allow decisions to be made to take some public actions, and even taking certain actions on how effective they were to effectively contain the spread of the virus, or would have been if we had implemented them fully. So these are, I think, very important issues. It's not a simple solution, but these are the parameters that we need to consider to reconcile the technology, the great technologies, such the ones that Maxim described in his company, Sparrow, is developing and putting in place. And then you collect all that data, and even if it is perfectly collected data, you know exactly where it was collected, the time, and the measurements are perfect. So, and then what can you do with that in terms of the policies allowed there, and then the data models on top of it? Can you trust the AI to make the right predictions? Is the AI being used to making the predictions that are, let's say, the good predictions for the good reasons, not because it is being misled by some parameters? No, we have classical examples on these in machine learning, but it is a big preoccupation, a big concern for the public health authorities that we're making decisions for understandable reasons. So this gets into a lot of other issues that I'll not try to address here in these closing remarks. So I think we had a very good session in terms of raising these issues, these topics, putting together the promises of various different technologies, innovative technologies, changes in the in structuring the conceptual arrangements that will enable good governance, and also the need to have a reliable or let's say solid assessment of the outcomes and how they're matching, improving the outcomes in this particular focus of the health outcomes. Of course, this could be also outcomes for other types of parameters in pollution and other aspects. So I think this the development of these, if you want, KPIs or validation of the outcomes, what is being measured, can relate it to actual improvement. So I'll just stop my thinking process here, and again thank Leonidas, Anna, and Maxime for their excellent presentations and exposing all the themes. I would like just to highlight that very soon we're going to have a continuation of this very good series, thanking Study Group 20 and the UNSCC for putting together this series of events that are very informative. I encourage everyone to join them in the future, and as well to spread the word. So we have the event number 18 tomorrow. Sits in the age of artificial intelligence, how to leverage technologies for digital transformation. On 7th of December, we have two other episodes 19 and 20. One in tourism in smart cities, reimagining the road to digital tourism, and another one on one-of-a-kind platform for digital transformation, the EU4 ESCC Austrian Country Hub, that will be taking place by the end of this year. So this you have here on the screen the summary of these events, and also the shortcut and QR code that you can scan to open the page where everything is maintained up to date. So with that, I would like to thank you for your attention, participation, contributions, questions, and see you next time. Thank you.